Hi, everyone. It's Dr. Erica Person with Flex Audiology, and today we are talking all things otoscopy. So we've labeled it Otoscopy 101, and we're going to talk about 4 key areas. The first one is just simply what are we looking for when we look in your ears? We're going to talk about the different types of otoscopy, different wax removal methods, and then why it all matters. But first, if you could do me a favor and click that subscribe button, that really helps us grow our channel and get our education out to the masses. So what are we looking for when we look inside your ears? The main culprit that we're looking for is simply going to be cerumen, aka earwax, that gooey goo that comes out when you use those Q-tips. And what we're really checking for is just simply, do you have too much of it? The normal ear canal does create a nice little layer around the ear, and that helps protect it. Earwax specifically is designed to collect any debris, any dirt, anything that kind of gets in your ears, and that wax is a natural cleaning self mechanism that comes out. But if you have too much, it will cause muffled sounds in your ears, feedback, and it can really break down your hearing aids as well. So we just want to kind of take a look, make sure we don't need to address that issue when you're in there. Second, we're just looking for perforations. Maybe something happened, airplane ride, something got in there. Any tiny holes or tears definitely tells us we need to refer you on to your primary care physician, get that looked at. We're also looking for any type of redness, signs of infection, fluids, anything that, again, we would want to medically refer you out to someone to get that taken care of. And then lastly, we're actually looking for filters or domes. Occasionally, our patients will come in and they have lost a dome or a filter, and we don't find out about it until we look in their ear, and then we see them in there. The most I've ever personally pulled out was just 2 that were in there, but I have heard of other audiologists tell me that the max I think I've heard is up to 5, and I just can't imagine all of that being in there. So let's talk about the actual otoscope itself. So usually what we use here at Flex Audiology is a standard otoscope. It's about this big. It's silver. I probably should have grabbed one to show you. It's just a little flashlight tool with a magnifier, and it's quick, it's portable, and it's easy really for what we're looking for in our field. And then the next step would be a video otoscope. Now we do have one of these in our Harrison location. So if you're really interested in seeing what your eardrums look like, that is the location to go to. So this tool actually will project a picture of your ear canal onto a screen so you can see exactly what we see, and it's pretty interesting. We tend to bring that also to our health fairs, little things like that, because people always want to take a look in their ears. And then last is what's called a binocular microscope, and this is primarily used by ear, nose, and throat physicians. It's very detailed. It's a much greater magnification. It's kind of a 2-eyed view, but it's really not something that most audiologists will have in their office. It's usually a very specialty tool. So let's talk about earwax removal and kind of the tools of the trade. So if we do find wax, don't worry, we've got you covered. So we're going to do some couple different methods here that we use. One is just simply manual method. So we use forceps, a little tiny loops, spoons, scoopers. We'll get in there and just kind of go around the edges, and that can take out probably 90% of the wax issues that we have here. It's pretty fast, it's easy, it's gentle. The second one that you might have had if you've gone to, let's say, an urgent care is what's called a hand flushing irrigation. And then typically they've got a little bowl right here, and they've got almost, it looks like just a big old water bottle, and they are just squeezing it into your ear to get that wax to come out. It's not the most comfortable thing if you've ever been through it, and sometimes it'll take 5 or 6 bottles for these nurses to get through. And a lot of my patients come to me specifically because they don't like the hand flushing aspect of it. When you squeeze it with your hand, the pressure coming out of that irrigation is based on how hard you're pushing it. So I've seen broken eardrums, I've seen infections, cuts, all kinds of nasty stuff. And then, of course, here we use the irrigator. And to me, it is the Cadillac of irrigation. It is temperature controlled and it's also pressure regulated. So patients will tell me it just feels like a little mini spa in their ears. Very gentle, gets the earwax out super, super fast, really quick. So we have people that come in probably every 6 to 8 months. I actually have one gentleman that comes in every 2 months to get his ears flushed because he just produces that much earwax. So really, really fun tool. So why does this matter? So clean ears aren't just about hearing better. That will definitely be a key piece. We have people that come in here because they just simply can't hear. And luckily it turns out just to be earwax and everyone's happy, happy, happy. For a maintenance appointment, the primary reason that we're cleaning out those ears, keeping it healthy, is to help protect your hearing aids and prevent breakdowns in the future. Wax is super sneaky. I know it's our ears that are moving the wax out, but I swear that wax moves itself right up into your hearing aid. So the domes are going to be your first line of defense. Then you have the filters beyond that. But if you can get a bunch in there, it will work itself right up that filter and into that little wire, or what we call the receiver. And once it clogs that microphone or the receivers, you do not hear very well, and it will slowly start to corrode away the pieces inside your devices. So that a clean ear canal definitely helps keep your devices in tip-top shape. So the next time your audiologist takes a look in your ear, now you know kind of what we're looking for. We're not just being nosy. We're trying to make sure everything's clean and healthy and that you can hear the absolute best that you can hear. If you have any questions, drop me a line, and I hope you guys have a great day.